guys, this is Dr. Teo Wan Lin, accredited dermatologist, and welcome to my podcast, Dermatologist Talks Science of Beauty. This week, we're going to talk about the Gorilla Glue hair incident that made headlines internationally.
Yes, that story was all over social media and the news. There are so many beauty dupes and hacks that people will try out and document over social media, and it's scary to see how one of these hacks going so horribly wrong and leading to pretty severe consequences. Well, for our listeners who might not be familiar with the incident, can you give us a short summary?
So as the story goes, a lady by the name of Miss Tessica Brown inadvertently ran out of her favorite hair care product known as Got2b Glue, and instead grabbed the Gorilla Glue, a spray adhesive that was in her home, to smoothen out her hair for a sleek hairstyle. And thereafter, we learned that she endured a 6-week ordeal, which was documented via her TikTok video of having the glue stuck in her hair. Now, the after effects of using permanent industrial strength hair glue, is certainly not going to be pleasant. But, what exactly happened in this case, and from a chemical and a medical point of view, what are the different take-home points that we can learn from this incident? Now, she apparently spent weeks after that washing her hair and, trying various at-home remedies before she went to a local emergency department. And then the nurses actually attempted to remove the glue from her hair. And that was with acetone, and it was actually unsuccessful. And then subsequently, we also learned that she traveled to LA to undergo treatment by a plastic surgeon by the name of Dr. Obeng. And under light anesthesia, we are told, he used a homemade solvent to remove the rest of the adhesive.
Yeah, I was actually following her story throughout the week through social media as well. I actually saw a video she posted of her slathering on some Pantene shampoo, which just sat on the surface of her hair and scalp despite her vigorously scrubbing it. The hair underneath was completely hardened and didn't even budge. This looks pretty dangerous to the hair and scalp. What are your thoughts as a dermatologist?
So the good news is that apparently the glue did not damage her scalp, and the affected hair that had been glued down for several weeks was cut off. And we're going to talk a little bit about what Gorilla Glue is and how we expect it to react with your skin and scalp. And in this case, certainly it did glue her hair down for several weeks. So it is an industrial strength adhesive. Most adhesives used are actually from cyanoacrylate glues. Polyurethane was the predominant ingredient used in Gorilla Glue as a fixative. And these are notoriously difficult to remove. Now, some of the conventional methods that have been used to dissolve cyanoacrylate glues are fatty or oil-based products, used for a long period of time, and certain petroleum-based ointments such as Vaseline to try to break down the glue. And I think in this case, Miss Brown actually tried these methods, which did not work for her. And in the emergency room, the nurses actually applied acetone. And this also, besides being unbearably uncomfortable for her at that time, wasn't successful. And separately, acetone on skin and on the scalp presents the risk of irritant contact dermatitis or even an allergic reaction.
Have you come across any similar cases in your dermatology practice?
It is not uncommon for individuals to have accidents with strong glues, like nail glue or super glue. And I think dermatologists have seen individuals who develop irritant contact dermatitis, and in more unfortunate cases, chemical burns due to the use of these products. Acetone rubbing alcohol have been used as DIY home remedies. It's important to note that the solvents itself can cause irritant contact dermatitis to skin. Well, the unique situation that Miss Brown was in was that she had really used a lot of the glue to try to put her hair together for a sleek gelled down look. What we know so far is that she has undergone surgery and that acetone was used to remove the glue, and all her hair that has been glued down has since been cut off. Dr. Obeng said that he created a solvent to dissolve polyurethane, which is the predominant active ingredient in Gorilla Glue adhesives, with a medical grade adhesive remover, aloe vera, which is anti-inflammatory and soothing with moisturizing properties, olive oil, and a little bit of acetone. He had apparently tested the concoction on a skull outfitted with real hair and extensions that he had matted down with Gorilla Spray adhesive and tested on it before using it on Miss Brown. Thankfully, there appears to be minimal damage done to Miss Brown's scalp, but let this serve as a cautionary real-world tale about why we really shouldn't be using random household products on our skin or hair, no matter how benign looking we think it is. Or it's probably wise for us to really read the labels of what these products are for, and also just use it according to the product's indications.
Yeah, you're right. We all have a lesson to learn from this. Don't use random products on your skin and hair. Well, moving on, hair grooming and styling practices are commonplace in our daily routine. Can you share with us how our hair care practices can affect how the hair grows?
Now, if you have normal hair and scalp, you may take it for granted and not realize that when problems arise, it can be truly challenging, and even a basic, function of daily living, such as grooming your hair, becomes difficult or problematic. Hair itself starts its life from the hair follicles, and the follicles are nourished by the oil glands, sebaceous glands, which produce oil to lubricate the new hair that grows out. There are also stem cells which initiate new growth in the hair follicle. The process of hair growth can be affected by inflammation. In this case, the amount of irritation that potentially can occur because of the industrial strength glue is possibly putting her at risk of a condition known as scarring alopecia. The secondary issue, of course, is that the glue itself will undoubtedly damage the hair shaft. Your hair grooming practices are affected by the natural type of hair you have. So if you have fine hair, you may find that you want to have more volume, and also you may struggle with frizz or difficulties keeping your hair in a ponytail. For individuals with African American type of ethnic hair, sometimes there is a desire to try to keep the hair looking sleek as opposed to its natural voluminous or curly texture. And this is the same reason why the salons perform procedures such as hair perming and relaxing the hair. It is true that a lot of women who find their curly hair difficult to manage and relax their hair simply because it makes it easier for them to style and comb. All of these procedures actually damage the structure of the hair. In order to change the natural texture of hair, you need to destroy the pre-existing bonds. Now, the problem really is that you are weakening the hair shaft, and it can result in chemical breakage, hair fragility, loss of shine, and elasticity.
I see. Well, what are the essential takeaway points about hair health that we can learn from this?
I think what is a true learning point in this case of the Gorilla Glue hair accident as well is also that there is a psychosocial impact that hair grooming practices has on the individual. I think for a lot of dermatology, our focus has been on scalp health, and the disorders of the scalp have traditionally been the major concerns that are treated medically. Hair shaft disorders and basic challenges with grooming have to do with the natural texture of hair, the health of the hair shaft, and hair shaft cosmeceuticals, for instance, is an area of research which can allow us to strengthen the hair shaft, increase the elasticity of hair, smoothen out the cuticle, and when you have a healthy hair shaft, it's much more likely that grooming becomes easier and there is less need for these spray adhesives, or at least we do not need to use so much of hairsprays. And in this case, we're really not talking about using true adhesives, which is what happened in the Gorilla Glue case. The other thing, of course, is when you have hair that is growing out of your scalp, it's important to understand that this hair is actually dead material. It's known as keratin. And the quality of the hair shaft depends both on the health of your scalp as well as hair grooming practices. If you have an inflammatory disease of the scalp, such as seborrheic dermatitis, psoriasis, or eczema, or scalp folliculitis, you may find that your hair cycle is imbalanced, and that means you can have more hair falling out than growing. Usually, 70 to 90% of our hair is in the growing phase, known as the anagen phase, whilst the remaining 5 to 10% is in the catagen or the telogen phase, which is the falling out phase. When the cycle is upset, for example, in the case of chronic inflammation, you can have an imbalance of the hair falling out versus the hair growing, and you find that you can develop hair thinning. In terms of the health of the hair shaft, if you have a condition known as male or female pattern hair loss, which is genetically determined, it's influenced by hormones, hair miniaturization occurs, and that means that the hair shaft that grows out of the hair follicle as you get older gets thinner and thinner and more miniature with time until the scalp itself becomes smooth and shiny.
Well, in the same vein, what are some treatments for hair loss?
If you suffer from these genetic causes of hair loss, you will benefit from using a hair regrowth serum or hair tonic. What has been proven to work is minoxidil at concentrations of 5 to 10%, but that actually causes some scalp irritation. Copper peptide is also used to stimulate hair regrowth and is a potent antioxidant. It can stimulate hair regrowth in the follicles. Using devices such as laser diodes, these are home devices, radio frequency, that's been shown to stimulate the hair follicle in a way that also causes like a phenomenon that we see in wound healing that's ideal for hair regrowth. It can help to strengthen the growth of the hair shaft. The use of LED light therapy, red light, yellow light, that also can encourage healthy hair follicle growth and healthy hair growth. It's important to note that in terms of the health of the hair shaft, most hair conditioners are a combination of smootheners and silicones, which besides being toxic environmentally because of the runoff into our oceans, they actually form a coating on the hair without actually strengthening the hair shaft. And this coating is removed whenever you wash it. Hair shaft cosmeceuticals, on the other hand, there is limited research, but then where there is evidence, some studies have shown certain hair oils derived from plants can directly regenerate and strengthen their hair shaft with improvement in hair elasticity, smoothness, and softness. And this can reduce the need for chemical rebonding or relaxing. The Lipid Silk and Lipid Shine Serum, for example, is a combination of sea buckthorn oil and safflower oil, which help to strengthen the hair shaft. Using proteins derived from silk, for example, can also help to strengthen the hair shaft.
Lastly, can you give us a few closing hair care tips on how we should maintain our hair health?
Well, I think overall, this incident should lead us to reflect on a few issues. Now, the obvious health-related dermatological complications we've discussed, but secondary concerns that might come out of this issue is really about how hair grooming practices are a huge part of our lives, and ethnic hair in particular may deserve special consideration. Basic hair grooming practices such as using a white tooth comb, or in my case, I like to use a wooden paddle brush to detangle hair when it's wet, because it minimizes static as well as hair breakage, as opposed to using plastic combs. Apart from that, using a hair oil or a hair serum can certainly strengthen the hair. A good formula can do so without weighing hair down. Options for hair shaft treatment can include the use of oils rather than silicone-based sort of masks, as the hair oils themselves have shown to be able to restore hair strength, elasticity, and smoothness. Heat is something that can certainly be harnessed to increase the absorption of the product into hair and can assist to manipulate the hair bonds, similarly to how using a hairdryer can help to straighten out unruly hair. And the heat treatment itself, say with the heat cap, is a lot more protective than using like a hair straightener or a salon perm or relaxing treatment, which actually really damages the hair bonds rather than repairing it.
Well, that's it for this week's episode on Dermatologist Talks Science of Beauty. You can follow Dr. Teo on Instagram at Dr. Teo Wanlin, where she posts updates on her latest podcast episodes. And remember to subscribe for the latest podcast updates.